this is the anterior aspect of the thoracic region. Here you see these are the ribs, these blue are the costal cartilages, and in the center you get the sternum. And then you focus, this is of course the clavicle. Now we have to learn about the bulk of muscle we see anteriorly, called as pectoral muscles or thoracoappendicular muscles, as they are connecting your thoracic wall with that of your upper limb, and also called as anterior axioappendicular muscles. So let's learn them one by one. So let's see first. This is the pectoralis major. It has got the clavicular head from which it gets origin through its anterior surface of the medial half of the clavicle. Then it has got the sternocostal head that originates from the anterior surface of the sternum and the upper 6 costal cartilages. And of course, there lies the external-oblique muscle and its aponeurosis. This portion is also giving rise to the pectoralis major muscle. This muscle is taking origin from all these sides and are going to converge towards the humerus. Now let's see that if I have to show you the posterior spect and I would remove this deltoid, now I can enlarge and show you the place of insertion of this pectoralis major. It is inserted on the lateral lip of the intertubercular groove, right? Now see, if I remove this pectoralis major, just below that you are looking into another muscle called as pectoralis minor, and you can see that it is getting origin from the 3rd to the 5th ribs, right? And it is a place where they are just near to their costal cartilages. Okay, now concentrate. If I can show you that this is also converging towards the superior aspect of the coracoid process of the scapula for its insertion. Okay, now if I also dissect this or remove it, I want to show you there is another muscle, if I can rotate it, which is called as subclavius muscle. Can you see that? It is present or gets origin from the first rib, right? And its costal cartilage, and you can see it's getting insertion on the undersurface or inferior aspect on the subclavius groove of this clavicle bone. So this is the subclavius muscle, right? Now we have to learn about another laterally rotated located rather, that is supposed to be there. Now about the 4th muscle, that is the serratus anterior. If you concentrate, it gets origin from the upper 8th, the thoracic ribs, right? And it has to wind round posteriorly, and let's see where it is getting attached. Let me dissect some muscles to show you. Now you can see this is the serratus anterior, and it is going to be attached on the scapula on the anterior aspect of the medial border of the scapula. This is the medial border. On its anterior aspect, it is getting insertion, right? So you can see covering that lateral aspect present here, and this is being supplied by the long thoracic nerve with root value C5, C6, C7, and it has to do the protraction of the scapula and hold your thoracic wall, and of course rotate your scapula, so helps in protraction and retraction as well. Let's see how. Now here you can see that your scapula is moving forward and backwards. So this is the protraction, forward movement, and this is the retraction. Is it clear now?